Have you ever left your doctor's office with a new prescription only to wonder if it's really the best thing for you? Or maybe you've been taking certain medication for years, but lately you've noticed some side effects that just don't sit right. Maybe you've brushed off new dizziness or forgetfulness as just getting older. But what if it's not you? What if it's the medication you're taking? If this sounds familiar, you're not alone. As we age, our bodies change, and sometimes the medications that once worked for us can start to do more harm than good. Take Martha. At 74, she started falling. Her doctor said normal aging until her daughter discovered her Valium was sabotaging her balance. Off that pill, she's back gardening pain-free.
Science confirms this. A 2023 study in the Journal of Gerontology showed that after 60, kidneys filter 30 to 50% slower. Our livers slow down too. Drugs linger longer, like uninvited guests. Yet the CDC says 40% of seniors take 5 or more pills daily. That's why today's chat is so important. We're exposing 4 common medications that steal senior strength and exactly what to ask your doctor to stay safe. I want to be clear. This isn't about scaring you or telling you to stop taking your medications. Medicine can be life-saving, and they play a crucial role in managing our health. But as we get older, our bodies process drugs differently. What worked for us at 50 might not be the best choice at 70. And sometimes, doctors might not always consider how a medication affects seniors specifically. That's why it's so important to be informed, ask the right questions, and work with your doctor to make sure your medications are truly serving you. Science shows seniors process drugs differently. In this video, we'll cover 4 common medications that can pose risks for seniors. For each one, I'll explain why it might be harmful, what signs to watch out for, and most importantly, what questions you can ask your doctor to ensure you're getting the best care possible. By the end of this, you'll feel more confident and empowered to have those conversations with your healthcare provider.
Before we dive in, I want to know, have you ever had a bad reaction to a medication? What happened? Let us know in the comments. Let's get started with the first medication on our list, benzodiazepines, or benzos as they're often called. These are a class of medications commonly prescribed for anxiety, insomnia, and sometimes even muscle spasms. You might recognize names like Xanax, Valium, or Advil. Now, these medications can be very effective in the short term, but for seniors, they come with some serious risks. One of the biggest concerns is their impact on balance and coordination. As we age, our risk of falls increases, and benzodiazepines can make that risk even higher. They can cause dizziness, drowsiness, and confusion, which can lead to dangerous falls and fractures. But that's not all. Long-term use of benzodiazepines has been linked to memory problems and even an increased risk of dementia. And here's the thing. These medications are often prescribed for long periods, even though they're really only meant for short-term use. My friend Linda from Ohio shared a story about her husband Bob. After his stroke, Bob took Advil for anxiety. Within months, he couldn't remember his grandkids' names. Linda fought for answers. They switched him to therapy and melatonin, and slowly his beautiful mind returned. Now, why does this happen? A 2022 study in the British Medical Journal found seniors on these drugs not only have a 50% higher risk of hip fractures, but they dull your alertness, like walking in fog. What's even scarier is that according to Harvard Medical School, long-term use hikes dementia risk by 32%. These drugs mess with acetylcholine, your brain's memory messenger. If you're taking a benzodiazepine, it's worth having a conversation with your doctor and asking, is this still my best option? Could we try cognitive therapy or safer choices like trazodone? Sometimes non-drug approaches like cognitive behavioral therapy or relaxation techniques can be just as effective and much safer for managing anxiety or insomnia.
Let's move on to the second medication on our list, non-steroidal anti-inflammatory drugs, or NSAIDs. You've probably heard of ibuprofen or naproxen. They're common over-the-counter pain relievers, and while they can be great for reducing pain and inflammation, they can also be risky for seniors. One of the biggest concerns is their effect on the stomach. NSAIDs can irritate the lining of the stomach, leading to ulcers or even gastrointestinal bleeding. And for seniors who already have a more sensitive digestive system, this can be especially dangerous. The New England Journal of Medicine warns seniors have 5 times higher risk of bleeding ulcers because stomach lining weakens with age. My buddy Marcus nearly lost his dad to NSAIDs. His dad took Advil daily for arthritis. At 78, he collapsed, rushed to the ER with a bleeding ulcer. The doctor said his stomach lining was paper thin. Now he uses a topical diclofenac gel and has 0 gut pain. But that's not the only risk. NSAIDs can also affect your kidneys, which is a big deal because kidney function naturally declines as we age. Over time, using NSAIDs regularly can lead to kidney damage or even kidney failure. And if you're taking blood pressure medication, NSAIDs can interfere with how well it works, putting you at risk for high blood pressure or heart problems. And Johns Hopkins research in 2023 showed just 7 days of NSAIDs can reduce kidney blood flow, risking permanent damage. Next time you reach for that pill, ask your doctor if you could try acetaminophen, known as Tylenol, or a pain relief cream, or maybe physical therapy instead. You might ask, are there safer pain relief options for me? Or could physical therapy or acupuncture help manage my pain instead? There are often alternatives that can provide relief without the risks.
Before we move on to the next medication, I want to pause for a moment and remind you, this isn't about fear. It's about empowerment. By understanding these risks and asking the right questions, you're taking control of your health and making sure your medications are working for you, not against you. And that's something to feel really good about. If this video is resonating with you, I'd be so grateful if you tap that like button. It helps others find this life-saving information and helps build our community. Now, what about that heartburn pill millions swear by? Let's talk PPIs, a pill millions take for heartburn. Proton pump inhibitors, or PPIs, you might know them by brand names like Nexium, Prilosec, or Prevacid. These medications are often prescribed for heartburn, acid reflux, or GERD, conditions that can be really uncomfortable, especially as we get older. And while PPIs can be incredibly effective at reducing stomach acid, they're not without their risks, particularly for seniors. One of the biggest concerns with long-term use of PPIs is their impact on bone health. Joan took Nexium for 10 years. Last winter, she slipped on ice and shattered her hip. Turned out, her bones were brittle. You see, stomach acid plays a role in helping our bodies absorb calcium, which is essential for strong bones. When PPIs reduce stomach acid, they can also reduce calcium absorption, leading to weaker bones and an increased risk of fractures. And for seniors who are already at higher risk for osteoporosis, this is a serious issue. Studies have shown that long-term use of PPIs can increase the risk of hip, wrist, and spine fractures. Even scarier, a landmark 2023 study in JAMA Internal Medicine, tracking 12,000 seniors, and the Journal of the American Medical Association have linked long-term PPI use to a 25% higher fracture risk.
But that's not all. PPIs have also been linked to other health problems, like kidney disease and certain nutrient deficiencies, such as magnesium and vitamin B12. And here's the thing. Many people take PPIs for years without realizing they might not need them anymore. But there's hope. Jane switched to Pepcid, an H2 blocker for flare-ups, and raised her bed 6 inches. No more reflux, and her bones are healing. Sometimes lifestyle changes, like eating smaller meals, avoiding trigger foods, or elevating the head of your bed, can manage acid reflux just as well, if not better than medication. So if you're taking a PPI, it's worth having a conversation with your doctor. You might ask, do I still need to be on this medication? Could we try a lower dose or H2 blockers like Pepcid? Or are there lifestyle changes I could try to reduce my symptoms? It's all about finding the safest and most effective approach for you. Now, before we move on to the next medication, there's something else you need to know. Something most doctors don't have time to warn you about. It's not just about single medications causing problems. It's what happens when they mix inside your body. Let me tell you about Richard. He's 68, and like a lot of us, he took a few different pills: Prozac for his mood, Tylenol PM to help him sleep, and a new medication for gout. Seems harmless, right? But within a few weeks, he started seeing things that weren't there. Spiders crawling on the walls. Turns out, those medications were silently teaming up to flood his brain with too much serotonin. And Richard's not alone. Studies show that 1 in 5 seniors on antidepressants are accidentally mixing them with other drugs that can turn toxic. And here's the scary part. It's not just prescriptions. Things you'd never think twice about, like cough syrup or even Pepto-Bismol, can clash with your medications in dangerous ways. The FDA has issued warnings about combinations that can lead to seizures, internal bleeding, even comas.
This keeps happening because of something called the prescribing cascade. It's when a side effect from one pill gets mistaken for a new health problem. Then doctors prescribe another pill to treat it. For example, someone takes NSAIDs for pain, but those pills bump up their blood pressure. Next thing they know, they're on blood pressure meds, which make them tired, so they get a stimulant. It's a domino effect, and Harvard researchers say 40% of seniors are stuck in this cycle. Second, pharmacies should catch these interactions, but they miss them more often than you'd think. Retail pharmacists are swamped, filling hundreds of prescriptions a day. One study found they overlook 60% of dangerous drug combos in seniors. A big one is blood thinners like warfarin mixed with aspirin or common antibiotics. That's a recipe for serious bleeding. Here are 3 questions that could save your life. 1. Could this new medication interact with something I'm already taking? A quick trick: use free online tools like Medscape's Interaction Checker, or ask your pharmacist to run your full list. 2. Is there a non-drug option I could try first? For example, Tai Chi has been shown to work better than Prozac for mild depression in seniors. 3. Can we do a full medication review? This is gold. Bring every single pill, prescriptions, over-the-counters, even supplements to your next appointment. Ask, do I still need all of these? You might be shocked at what can be cut. Because here's the truth. No one knows your body like you do. And sometimes the best prescription isn't another pill. It's asking the right questions.
Now, let's move on to the 4th medication on our list, anticholinergic drugs. This is a broad category of medications that includes things like certain antihistamines, sleep aids, and even some medications for overactive bladder or Parkinson's disease. You might recognize names like Benadryl, Ditropan, or even some older antidepressants. Anticholinergic drugs work by blocking a neurotransmitter called acetylcholine, which can help with symptoms like allergies or an overactive bladder. But for seniors, these medications can have some serious side effects. One of the biggest concerns is their impact on cognitive function. Anticholinergic drugs can cause confusion, memory problems, and even increase the risk of dementia. In fact, studies have shown that long-term use of these medications is associated with a higher risk of developing Alzheimer's disease. Charles, a retired teacher, took Benadryl nightly for allergies. He started missing bills, forgetting lunches with friends. His daughter insisted on a med review. Within weeks off Benadryl, Charles was back to teaching chess at the community center. That's the power of questioning one pill. And that's not all. These drugs can also cause dry mouth, constipation, and blurred vision, which can be particularly bothersome for seniors. The science is chilling. The American Geriatrics Society's landmark Beers criteria, updated yearly, flags these as top drugs to avoid in seniors due to falls and confusion risks. Why? A 2019 JAMA Neurology study found they hike dementia risk by 54% by blocking acetylcholine, which is critical for memory. So what can you do if you're taking an anticholinergic drug? First, don't stop taking it without talking to your doctor, but do have a conversation about whether it's still the best option for you. There's safer swaps, such as newer allergy meds like Claritin or bladder retraining therapy, for example. Ask your doctor, is this on the beers list? Are there safer alternatives for my condition? Or could we try a lower dose or a different medication? In many cases, there are newer medications or non-drug approaches that can manage your symptoms without the risks associated with anticholinergics.
Now, before we move on to the final part of this discussion, I want to take a moment to acknowledge something. Talking about medications and their risks can feel overwhelming. It's easy to worry or feel like you're doing something wrong. But here's the truth. You're not doing anything wrong. You're taking steps to take care of yourself, and that's something to be proud of. The goal here isn't to scare you. It's to empower you with the knowledge you need to have informed conversations with your doctor. At the end of the day, your health is your greatest asset, and you deserve to feel confident and in control. Because when it comes to your health, you're not just a patient, you're a partner in your care, and that's a powerful place to be. Now that we've covered these 4 common medications, benzodiazepines, NSAIDs, proton pump inhibitors, and anticholinergic drugs, I want to leave you with some practical steps you can take today to ensure your medications are working for you, not against you. Because here's the truth. Knowledge is powerful, but action is what creates real change. First, if you're taking any of the medications we've discussed, don't panic. This isn't about stopping anything abruptly. That can sometimes be even more dangerous. Instead, it's about starting a conversation. At your next doctor's appointment, bring up your concerns. You might say something like, "I've heard this medication can have risks for seniors. Is it still the best option for me?" Or, "Are there safer alternatives we could explore?" A good doctor will appreciate your engagement and work with you to find the best solution. Second, keep a current list of all your medications, including over-the-counter drugs, supplements, and vitamins, and bring it to every medical appointment. This helps your doctor spot potential interactions or unnecessary medications. You'd be surprised how often seniors are prescribed multiple medications that don't play well together simply because different specialists aren't communicating. A 2023 Mayo Clinic study found 60% of seniors have dangerous drug interactions no one caught.
Third, ask about deprescribing. This is a growing movement in medicine where doctors help patients safely reduce or stop medications that may no longer be beneficial. It's not about denying treatment, it's about tailoring it to your current needs. No one knows your body like you. When my sister fought to ditch her risky sleep meds, she told her doctor, "I want to live fully, not drowsily." Today, she's in a salsa class. So you might ask, could we try reducing this medication slowly to see if I still need it? Many people find they feel better after carefully stepping down from certain drugs. Finally, remember that medication is just one tool in your health toolkit. Often, lifestyle changes like gentle exercise, a balanced diet, stress management, or physical therapy can reduce your reliance on medications while improving your overall well-being. It's never too late to make small, meaningful shifts that add up to big benefits. So as we wrap up, I want to leave you with this thought. You are the expert on your own body. No one knows how you feel better than you do. By staying informed, asking questions, and advocating for yourself, you're taking control of your health in a powerful way. And that's something to celebrate. If this video resonated with you, I'd love to hear your thoughts in the comments. Have you ever had an experience where a medication didn't agree with you? What questions have you found helpful to ask your doctor? Comment "safer" below if you'll chat with your doctor this month. Your stories might help someone else feel less alone in this journey. Subscribe for more health talk and more honest, practical advice on thriving in your 60s, 70s, and beyond. Your future self will thank you. Because getting older isn't about slowing down. It's about living your healthiest, happiest life on your terms. Here's to making choices that help you feel your best today and every day. Thanks for watching, and I'll see you in the next video.